Yazoo physical therapist, here with your Movement Minute for today. So today we're going to talk a little bit about breathing. Did you know that breathing is something that you do about 20,000 times a day? It is pretty much an unconscious thing that we do. If your muscles aren't very optimized, when you do it 20,000 times every day, can certainly add up and lead to some issues. So here are just some things for you to think about in regards to your own breathing. So when we breathe, we should have expansion of our trunk and of our rib cage in what I like to call 360-degree breathing. That means that the front and the back of the rib cage should open like this, and that from side to side of the rib cage you get out and in as well. And so really 360 degrees should be how your rib cage is moving when you're taking optimal breaths. But what I see a lot sometimes is that either you're super dominant through your tummy because you've been taught, belly breathing, and that's the way that you think you should breathe all of the time. I'm not saying belly breathing is bad. Certainly, it needs to move as well. But what I tend to see is that there's so much, mental training that goes into, okay, I really want to just expand my tummy, that the rib cage then doesn't move, and it all has to work together. And I've also seen vice versa, especially with people who have had abdominal surgeries, or moms who've had cesareans, or even just moms, new moms, after, any type of delivery. So that they will be moving more through their upper body, and their abdomen, barely moves at all. And so, some of that, as far as with moms, is related to the pregnancy, how your muscles stretch through your abdomen when you had your baby, and also your recovery afterwards. A lot of that is super trainable and really important that you reconnect. And so regardless of who you are, if you notice that you are more of an upper chest breather, and you don't do anything down here, or you're more of a belly breather and you don't do anything up here, it's important for you to be able to do all of the breathing ways and not just be super dominant in one way. This is nice for, again, kind of seeing from the front, chest and tummy. So if you want to see if you are getting that lateral expansion, you want to put your hands up here, right? If you're down here and you're, by the pelvis or along, your abdomen, lower abdomen, where you have that soft tissue, you're not going to feel what you need to be feeling. So really make sure that your hands are up on your actual rib cage. So you should feel your rib bones underneath your hands. And I want you to take, again, regular breaths, just shallow breaths, and see just what is moving. Is it moving at all laterally? Is it not moving? And then take deep breaths and see how far you can actually expand. And then follow your hands back down. So you can actually kind of see that rib excursion, or that rib range of motion in that lateral plane, and see what are you doing through there. Are you not getting any lateral motion? And I see that a lot, because a lot of times we don't even think that our rib cages can move that way. But they should, and it's a part of, again, that 360-degree breathing that is important to optimize your respiratory system and all of the muscles that help you breathe. So that is an easy way to assess that as well. So next week we will talk about some breathing exercise strategies that will help to optimize in whatever way you need optimizing. So maybe it's you need to have more movement from the upper chest. Maybe it's you need to optimize and increase your movement through your abdomen. Maybe it's that lateral expansion. We'll go through a few specific things that you can do with some specific tools that you might have lying around the house that are really helpful to do to optimize your breathing. Remember, this is something you do 20,000 times a day. So you want to make sure that you can do it with all of the movement options and the entire system being optimized versus just doing it the way that feels easy to you or the way that you've always done it. Because if you want to improve your performance, if you want to improve your literally the oxygen that is going to your body for recovery, for everyday activities, the breath is super important. And I will see you next week.